students and residents. I'm Niten Singh. I'm the chair of the Vascular Surgery Interest Group for the Western Vascular Surgery Society. And our committee members are Leigh Ann O'Banion and Greg Magee. Today we got a great webinar on why people went into vascular surgery. If you're attending this call and you're thinking about going into vascular surgery, you probably made one of the best decisions of your life. Probably not the best, but probably in the top 3 of your life after getting married and having kids and all that kind of stuff. But vascular surgery is probably one of the best things you can go into as far as specialty. And if you, I hope by the end of this session, you'll think the same. I am going to introduce our current president, Vince Rowe, is professor of surgery at the University of Southern California, and let him offer some insights before I turn it over to Dr. Greg Magee, who's also from USC, to moderate this session. Vince.
Hi, thanks, Niten. Hello, everyone, and thank you for joining us this evening. We're very interested in people recruiting into vascular surgery. It's so important for us. Hopefully you'll sense the enthusiasm of everyone that takes part in the talks tonight, and our speakers are all well-esteemed vascular surgeons. For me, I'm kind of long in the field. I'm the oldest one here in the group that has been in vascular surgery over 20 years. And I say that with still interest in the field and seeing exactly where it continues to go. It's so much different, but yet it's so much the same as to how it was when I first started. The field is exciting, it's ever-changing, it's full of innovation, full of challenges, full of rewards, and I think it's a tremendous field to enter. So there's still plenty of room for you. Just keep in contact with us and we'll shepherd you in. And so I just want to say thank you again to the VSIG committee, to our guest speakers, and to you signing in to learn more about our wonderful specialty. Thank you very much.
Thanks, Dr. Rowe. I'm going to turn it over to Dr. Magee now. One thing is, for people listening, if you got a question, please put it into the chat, and we will get to them during the panel discussion towards the end. Thank you very much. Greg?
Yeah, hi, I'm Greg Magee. I'm assistant professor of surgery at USC. I work with Vince Rowe. And I'm first going to introduce you to Leigh Ann O'Banion, who is at UC Fresno, and she's going to talk to you about why vascular surgery. And then we'll go into the different pathways with the ON5 program and the traditional 5+2 program. So without further ado, Leigh Ann.
I have a little imposter I'm trying to get rid of right now. All right, let me share my screen. Sorry, I'm just having trouble sharing my screen. Give me 1 second. All right. Okay, so I'm going to be talking about why I went into vascular surgery and some options for medical students. No disclosures. So why vascular surgery? Well, I might be a little biased, but I think our tribe is pretty awesome. Even this panel of esteemed colleagues that are with me tonight, I love each and every one of you. And so I think we have a really cool group of people that we get to hang out with on a daily, monthly, yearly basis. We've got fantastic procedures and patients. We have cutting edge innovations, both open and endovascular. And we're constantly learning about all these minimally invasive procedures and refining the large open operations. So we have so many tools in our toolbox, and it's kind of the cool thing about being a vascular surgeon is that we can do the same things that we've been doing year after year, but we are also constantly changing the way that we treat our patients and developing new things to care for our patients. So I couldn't help but show a couple of pictures. Sorry if anybody's trying to eat dinner right now. But these are some of my favorite operations. I think that there's nothing cooler than being able to heal a foot, and perform, cutting edge limb salvage operations is just so awesome and gets me excited and out of bed every day. We can also do really cool things endo. When patients come in and they're dying from a ruptured aneurysm, we've got minimally invasive techniques to fix those operations. to fix those patients. And then, you know, just like here on the right, you can see a patient that was fixed endo, but they also have a bypass that someone else did that's been open for like 20 years. And so vascular disease never ends. And fortunately or unfortunately, people aren't going to stop smoking anytime soon, which is going to keep us all in business for quite some time. And then one thing that I think everybody gets excited about is an open AAA repair. And so these, I think, will never go out of favor. There's always going to be a role for an open AAA. So it's exciting to get to do big open operations. And even though we're going to do a ton of endo repairs of our open AAAs and aortoiliac occlusive disease, when things fail, we still get to be the ones to fix our patients. And so I think that's really cool too, is that we can follow our patients from beginning to end. And, you know, finally, carotid disease, really exciting, stroke prevention, really cool technology up on the forefront. So not just the open carotid endarterectomies, but the TCARs for patients who aren't open candidates. So, you know, it really is exciting to be on the forefront of all this exciting technology and really have the opportunity to offer your patients so many different avenues to improve their care. And then lastly, trauma gets me excited. I know it doesn't get everybody excited, but blunt aortic injuries, open repairs of really challenging mangled extremities. And so we really get to kind of do the whole scope of patient care when it comes to vascular. So why did I choose vascular surgery? Well, you know, as a medical student, you kind of get a sense for whether you're procedural based or not. And that's kind of the first big decision I think every medical student makes. Some people might want to go into pediatrics. Some people may not want to be clinical at all and may gear towards a radiology or pathology specialty. But I think the most important thing is to identify people that you relate to and you enjoy being around. Because at the end of the day, this is going to be probably where you spend most of your time. Oftentimes, I spend more time at work than I do at home. And so it's really important to be around people that you like to be around. And I think you'll get a sense of that as you go through med school and you do your rotations. Who's your crew, who's your clan, and who you identify with, who you really enjoy being around. And then the types of patients that you enjoy taking care of. This is probably the most important thing because you really have to love the patients that you're taking care of in order to do the best job that you can do. So originally when I was in medical school, I was kind of I knew I wanted to do surgery. I was kind of thinking plastics, maybe trauma. I rotated and did a bunch of different rotations. Really loved it all. So I was like, well, you know, when I was graduating med school, there wasn't the opportunity to do an O&5 vascular residency. And so I went into general surgery because I had no idea what I wanted to do. And then I rotated on vascular as a PGY2 and got to do a bunch of limb salvage procedures, and I saw the, you know, patients and how they did afterwards and how happy they were and the satisfaction of seeing a red hot foot. And I was hooked. But let's see. There we go. So when I was on general surgery, really kind of like an enlightening thing for me was that I did vascular and I loved all the operations that it had. But then I rotated on other rotations that I thought I was going to be interested in. So I did trauma, and I realized what I loved about trauma were actually the vascular injuries. They were really cool. And then I rotated on plastics and realized I actually didn't like plastics all that much. But what I did like about plastics were the free flap anastomoses. And I was like, well, hey, I can do that every day in vascular. So I really found that vascular encompassed everything, including the patient care aspect of it that I wanted to do in life. And then as a PGY3, I went to the UCSF Vascular Symposium and I met all these awesome people and I saw, wow, these people really love what they do. They have a passion for their jobs. They love their patients. And, you know, I met all these giants in vascular surgery and I was hooked. I was like, I want to be with these guys one day. And that really kind of solidified my decision. The comprehensive care of vascular disease, the fact that vascular surgery, you really have to be the ultimate in a precise surgeon. Every bite matters. You really have to do a distal tibial bypass perfect or you're going to be back. And so you really get that instant, immediate gratification, or in some instances, sorrow. And then for me, the lifelong patient care, we really are the family practice of surgery. And that's kind of what I tell the residents and the trainees as they come through, is that I see my patients from the moment that I meet them all the way through, a lot of times, their end of their life. And it's great because they ask me how my kids are doing, and I, ask them how their grandkids are. And it really is a great relationship that you get to develop with your patients. The multidisciplinary family, podiatry, cardiology, the family medicine doctors, you're really going to get to have that comprehensive care of the patient and interact with a lot of other subspecialties. And then at the end of the day, we really are the firefighters of most operations. And so when things are on fire, they're typically calling the vascular surgeon. And so while that may be a little bit stressful, it is kind of cool to think that you're the person that's going to come in and fix things when everything's going wrong. And then there's great people. Meeting and having such great colleagues and friends who have actually become like part of my family. It's my vascular family. And having mentors. It really is just a wonderful specialty. And I think, I'm really fortunate and lucky to be part of it. So what do I like about my job? I really do have the best patients. I love my patients. They're underserved, they're underrepresented. They really need us the most. They're older patients. They have stories. When you're sitting in clinic and you're just listening to these patients' stories, you just learn so much from them, and the ability to follow them lifelong. Both of these patients in the pictures, obviously I've taken these with their consent. They have had multiple bypasses and ultimately lost their leg, but it's really cool that life doesn't end with limb loss. And so I continue to see my patients even after they've had their amputations, and they come back year after year because they still have another leg. And I get to see how they're doing and see how they're thriving in the community. And that's really satisfying and gratifying. Having a great team is really awesome. Having a tow and flow team working closely with podiatry, your techs, your nurses, our team loves what they do, and it's really fun to go to work every day and have a team that really enjoys being there and you can work together. And then my partners, really teamwork makes the dream work. And I know that's really cliche, but I couldn't do my job without having an amazing team. And so having the support of your colleagues and your coworkers, really just to look out for you. I know when, I've called Greg, I've called Niten, I've called, a handful of everybody on this call when I have a tough case or, things are going wrong. There's a plethora of colleagues to reach out to, and that's really awesome about this specialty. And then getting to teach. Not everybody's going to go out and practice and do this, but I love being part of a teaching institution and paying it forward. I was so lucky to have amazing mentors who taught me. I think it's really great to be able to give back and teach the future generation of vascular surgeons. So a little bit of ending advice for medical students. If you know you want to proceed with vascular surgery in an integrated residency, do a sub-I at your institution. If possible, also do some away sub-Is to see other institutions. Ask questions about your specialty. Talk to trainees. Go to the meetings. Talk to people. We love to chat about what we do because we love what we do. So come and talk to us. If you're not 100% sure, but you want to be a surgeon, maybe go the general surgery route, rotate on vascular surgery, explore other areas, find out what you like about certain specialties and what you don't like. Consider doing maybe a year of research or getting involved in some research, and apply for the fellowship. There's multiple avenues to get there, and I think that Dr. Ross and Dr. Zettervall are going to get a little bit more into that. And finally, these are my kids. They're part of the reason why I love what I do. So I had to end with them. So if we have any questions, but if not, I'll turn it back over to Greg.
Leigh Ann, that was a great talk. Especially important, I think, is how much we love our jobs and how much fun we have working together. And the firefighter part, I think, is a real deal. Like one of my favorite quotes is, who do you call if you're in the operating room and you're in a lot of trouble? It's more times than not, it's a vascular surgeon. But if you're a vascular surgeon and you're in trouble in the operating room, who do you call? more often than not, it's another vascular surgeon to help. And I think that speaks to our specialty a lot. So next, we're going to have Sarah Zetterall from University of Washington to talk about the 5+2 program as a pathway to vascular training. Sarah?
All right, thank you guys so much for the invitation, and I'm excited to talk about the 5+2 pathway. One sec. So I have no disclosures, but I should say I am a product of the 5+2 pathway. So take with that what you may, for better or for worse. So I thought I'd start a little bit by just talking about my journey, because I think it shows some of the good and the bad. So I obviously went to medical school. I thought I was going to go into women's health. And I did that for the first 2 years. And then on year 3, I went into general surgery and everything changed. I realized I absolutely loved being in the operating room and everything that came with it. And I did rotations in surgical oncology and plastic surgery and orthopedics, and I loved all of it. But I really was drawn to the general surgery side of things. And so the 4th year I did general surgery sub-Is. And again, I did trauma and colorectal and MIS. And I think the thing that you see here that was missing was that I had 0 exposure to vascular surgery. So I had no idea, other than kind of seeing the vascular surgeons come in during these difficult trauma cases, kind of the full breadth of the field. So from there, I went to general surgery residency. I did it at George Washington in DC. And that as a PGY2, I had my first exposure to vascular at the VA, and it was awesome. And I think everything changed at that time. It was an open aorta, and I was just so excited to be there. And I thought it was all of the best of general surgery, but in a really specific patient population, which I just fell in love with. And so I kind of had an idea that I wanted to do it. And then I went on to my PGY 3 year, and I realized, you know what I also really liked was the anastomosis on hepatobiliary cases, which kind of have that similar technical finesse that's required. And so at that point, I sat down with my chair and said, you know, it's research time. Let me take this time and really think about it. And so I went and spent 2 years in the lab, and I went up to Boston under the mentorship of Dr. Mark Schermerhorn and Raul Guzman, and sought to kind of really dive into the nitty gritty of vascular. And what I found is, much like Leigh Ann mentioned, is the field is just innovating and evolving so rapidly. And there's so many unanswered questions, which just makes you so excited to be a part of it. And so I went to the lab and loved it. And I had a really productive 2 years. I traveled a lot. I went to 10 different countries. I made some money moonlighting. And I published some articles as well during that time. So overall, it was just an amazing experience. And so I went back to residency after being in the lab, super invigorated and just 100% committed to vascular, because I knew I loved the clinical. And then I got into research and realized, wow, there's just so much exciting to offer. And so I went down the path and applied to fellowship, and I applied really broadly. I applied from coast to coast. I just wanted to see all of the opportunities out there. But ultimately I decided to go back to Boston, and I went to BI Deaconess for fellowship, which was super busy, great 2-year experience. And I finished there, and then was really lucky to come out to the University of Washington, where I got to kind of put together the 2 things I fell in love with in residency and fellowship. And that was complex aortic surgery, which I'm really fortunate to be a part of here at UW, and research, which I also was able to then intertwine into my practice, which just made it so rewarding. And so then I take a step back and I say, okay, well, I loved my journey, but what are the cons? And honestly, this was a little bit harder for me to put together, because I really thought that journey made everything that I do today so worthwhile. But I did, and I took a step back and I realized, I think probably the thing people talk about most when you're doing the 5+2, or in my case, 5+2 and 2, is time. So it's ultimately, my path was 9 years after medical school. And that compares to a 0-5 program where you get to do 5 years and then get to come out and really be done. And so, I mean, time is significant. It matters. Everyone works really hard. And so it's nice to finish and get to spend all your time doing what you love. The other thing with time is, in general surgery, you do spend time away from vascular, and there's good and bad sides to this. But I mean, again, every day is something different. I think we don't talk about money that much, because it's all expected that we all love what we do, so money shouldn't matter. But I think, as you guys who are finishing med school know, it's hard. Many of you are going into debt, and the loans pile up and you kind of feel that on your shoulders. And so that time equates to money. So you have more time in the 5 and 2 kind of making a low salary. And then you also have the cost for fellowship, although I understand they're much less significant now as things are virtual, but they're not zero. And so then we talk about, any other cons. Well, I think it comes back to the same thing, exposure and volume. As a 5 and 2, you spend a lot of time doing general surgery, which is great, and I loved it, but you do a lot of cases that you ultimately may not do in practice. I don't do colonoscopies, I don't do robotic surgery, and I did a lot of that in training. And I think you also can have at times variable experience with vascular surgery, and some of that depends if the place that you go has a fellowship and a residency. I will say where I trained, I did not, and I graduated with over 250 vascular cases, and I loved every single minute of it, but that's kind of not universal. And I show you here, and this is the minimum case requirements for general surgery residents today. And when you look at it, what you see is when you look at vascular specifically, yeah, you do have to do vascular, you have to do 50 cases, but that's much different than if you were to do a 5 and 2 program. And so I'd say kind of moving on, then we talk about the benefits. Now, the benefits in some ways are the same. I think it comes back to exposure and volume. If going down the 0 or the 5 and 2 pathway, you do a lot of operations because you have to finish all of those requirements I showed on the last screen. And a lot of that is exposure to the abdomen and all the vasculature, which you're always thinking about in every general surgery operation, because the general surgeons don't want to get into the vasculature. That's terrifying, and that's where they need to call for help. So you're always thinking about the vasculature, so you do get that volume. I think most specifically, one of the things we all really love about what we do is the people we get to work with. And being a general surgery resident to start is a really awesome opportunity to get experience collaborating with fields of other specialties and really understanding what they do. I think it makes me a better vascular surgeon, and it allows me to go in and help in these cases with a much higher degree of comfort than if I hadn't worked with all these folks previously. I think the 5 and 2 program also gives you the opportunity to do leadership in some of the scariest situations. I think the two things that come to mind are the trauma codes. And specifically the ED thoracotomy. I think I will never forget my first ED thoracotomy and cross-clamping the aorta. I'm sure everyone on this call has the same. And you do that in your senior years as a trainee, and it's really formative, I think, for everyone, and it really sets you up well. And then I think the other thing to note is the 5 and 2 program really gives you some extra time to mature, which is exciting, because then when you start your vascular training as a fellow, you can really purely focus on the operations and the management, because you don't have to kind of think about all the other things you're also trying to do. Now, that's not to say that the 05s don't, because they are equally as equipped to do all of this by the end. But it's, another plus side of things. And then kind of concluding. So again, pluses and minuses. So time, I think the 5 and 2 experience really gives you time to figure out what you love. If you're someone who maybe didn't get as robust a vascular experience in med school, it doesn't mean you can't be a vascular surgeon. I think I'm a perfect example of that. I had zero exposure to vascular surgery before I was a PGY2. And so I got to figure it out by putting in the hours and doing the operations, and it was awesome. And it was a perfect path for someone who otherwise wouldn't get that. It allowed me to see what's most important to me and what areas of care I liked both. And then finally, I think the research years, which you very frequently get and are very strongly encouraged in some of the 5 and 2s are great. I think it gives you time to develop your CV. If again, you didn't quite know what you wanted to do when you were in medical school, you'll have those years to do it, to make yourself a really strong candidate, both for your training, but also for your career. I can say personally, I had 0 publications going into residency. I have certainly gone the other direction since then, but it means, I think it's a good example that where you are right now does not need to dictate where you are in the future. I think all pathways are really viable to becoming whatever kind of vascular surgeon you want to be. I think research is also fun because it gives you time to develop your personal life, to travel, to spend time with family, get time to make some money, and to just take a breath and reflect on kind of what you want to do. So, I mean, I think these are all really great experiences. that really, at least for me, formed how I got to be where I am. So kind of wrapping it up, I think general surgery and fellowship continues to be a really great option for training. I think there's certain groups that it's even more helpful for. And I think those are folks who are not yet positive of their interest in vascular, often because they just haven't had that exposure. And it also is a great opportunity for those who are really dedicated towards academics. And it doesn't matter where you went to medical school. If you really want to take additional time to kind of hone in on that, I think it offers a great opportunity. I think the caveat to that is you should be selective. You guys are amazing candidates. And I think if you want to do this route, it's a great option, and just be selective about where you go to ensure you have, the maximal opportunity. I'll finish it up by saying I certainly would not be where I am today, which is a wonderful practice that I love and a job that makes me very fulfilled every day, without this pathway. The people I work with are phenomenal across the board, and all of the people in all of these different steps in my training, from residency to my time in the lab to my position at University of Washington and fellowship, have all kind of been really formative to me, and they've all been wonderful. So I think regardless of which route you choose, the opportunities are there, and there are always the people who are going to be there to support you. And I will stop there.
That was a great talk, Sarah. Thanks for that. So now we have Elsie Ross from Stanford, who is an assistant professor there, to talk about the O and 5 pathway. Any questions, leave them in the chat.
Oh, yeah. Let me share my screen. One second, this is going to be complicated. Let's do this. So Dr. O'Banion and Dr. Zetterwall just did an amazing job of describing their interest in vascular, and I will say that this is going to be a way more boring talk, partially because of my career path and staying at the same place for about 20 years. But hopefully it gives you just another glimpse into another career path. And I'm actually going to do it this way. Do you see my screen? Yep. Okay, great. So I'm going to talk about the O&5 vascular residency program. I'm not quite sure why it's called O&5. I guess it just means that there's no general surgery in the front, and it's 5 years of dedicated vascular surgery. Although you do get some general surgery in between, and I'll kind of lay out the paradigm that I went through in my training. So again, some background about me, because I think in terms of my pros and cons, it'll give more context to why I say what I say. But I grew up in New York, and then I found out that Chelsea Clinton was attending college at Stanford, and so I thought it was the coolest thing ever. I came, I saw the church, and I was hooked. And so I've been here since undergrad. So I did my undergrad here, my medical school here. During our medical school training, we're encouraged to think about the world outside of medicine. So you're going to be a doctor, but what's the other thing that you're going to do? And at the time I was really interested in health policy. And so I went to London because I was like, I need to leave Stanford to see the world. And that was an amazing experience. And I thought I was going to be a health policy researcher. I was fortunate enough to find mentorship during medical school. I came back from London thinking I was going to be a pediatrician, but then I stumbled into a vascular surgery OR, and the rest is history. And so in terms of my clinical training here, the first 2 years were kind of the foundational years that included things, general surgery, ICU, but also things like cardiology and imaging, which were really interesting and added to the breadth of understanding of vascular disease and how to take care of really sick vascular patients. Our year 3 here, and this paradigm is pretty much the same to this day, is all vascular. So your 3rd year is really the year that you are made into the vascular phenotype. You see a lot of consults, you're in the operating room a lot more. And you, at that point, should know pretty well whether or not you want to make a career of this. Or, and then here, and not every program has this, but at certain programs, you're encouraged to leave the OR for a couple of years and find a research avenue. And so I did 2 years of research with grant funding from the National Institutes of Health to study biomedical informatics, which continues to play a large role in the research I do today. And then in year 4, we have an interesting amalgamation of rotations, but one includes rotating on cardiac surgery, so helping them do type A's, CABGs. I didn't really go in a TAVR room, but some of us do because it's applicable in terms of endovascular considerations. Then you do a few months of vascular, but then we have this awesome opportunity to go rotate in Canada for three months. And part of the founding of that rotation started with the understanding that at some point in Canada, supposedly, because it's a public health system, they run out of money to buy stent grafts. And so they're more likely to do open aortic cases than they are to do endovascular ones. And so, hey, Stanford folks who focus on endovascular all the time, why don't you go learn from the Canadians some tips and tricks of doing open aortic surgery? So that was an awesome experience, both culturally, learning about a new health system, and doing more repetitious open cases. In the 5th year, again, this isn't all vascular all the time kind of year, but again, because there is so much focus from year 3 on down on vascular surgery, you can start tailoring things to things that you're really interested in. And so the opportunity presented itself to learn about how the Italians do thoracoabdominal aneurysm repair open. And I can't say that I wanted to be like a thoraco queen, but like the idea of going to Milan for a few weeks and then spending the rest of my time, like, you know, vacationing and learning about Italian culture, like just got the best of me. And so I had the chance to go out to Italy for a month at the end of my vascular surgical training. So all in all, it's an ON5 program, but in total, that was 7 years of training. And so currently, I am a surgeon scientist. So part of my time is taking care of patients in the clinic, in the OR, and the cath lab. And the other time is running a research lab where we try to apply machine learning and to develop insights or derive insights about how to better take care of our vascular patients and predict outcomes. So in terms of the pros of the ON5 pathway, I will share this bit of research. So Chelsea Dorsey, funny enough, was the resident the year above me. She had matched and then I had matched the next year. And she was really influential in getting me through my ON5 time because, you know, surgical residency can be hard and it's great to have people you can lean on. So she was interested in looking at workforce diversity in vascular surgery and I knew some stats. So she called on me to help with this project. But one thing that struck us when we looked at the numbers is if you look at vascular surgery fellows, well, first I'll say, let's ignore the very, very low number of minorities in vascular surgery. That's for a different talk and a different time. But what's striking is if you look at the number of women in vascular surgery fellowship from 1999 to 2005, it was pretty abysmal in terms of women who chose to go into vascular after general surgery. But thankfully, over time, that's improved. There's still a lot of work to be done to see that, you know, the number of women who want to do vascular surgery out of general surgery is higher for more representation, talking more about how there is work-life balance and addressing the kinds of things that women versus men think about when they choose a specialty. So the numbers in general are for vascular fellowship are a little low, but when you look at the integrated pathway started around 2013 and it's been above the 30% mark for the longest time. And so you can kind of, if you talk to people, trainees, med students who are interested in going into the integrated pathway, one of the things that an ON5 program has a huge advantages in is time, like Dr. Zetterval had mentioned, is that it's supposedly faster. You focus more on the things that you want to do. And so I remember in my cohort of people who went around interviewing, some women were like, you know what, maybe I'll do like big vascular cases for a long time, and then one day maybe I just want to do veins, and going the vascular surgery integrated route allowed them to do that in a faster route. Not to say that only women do veins, but you can think about a career arc within vascular surgery rather than going through general surgery, figuring out what you want to do, and then going into vascular and figuring out that way. So I'll say that the pros of the ON5 pathway are less time, although this time can be made up in time you spend doing research and other things, but there is more flexibility. There is the idea that you focus on what you love. In the first few years of general surgery, I did find things interesting. I did love trauma, but when I was a third year on vascular all the time, I fell in love with all over again with vascular surgery and knew that that was the right thing for me. And then there's a long time thinking about vascular problems, which is interesting because it can be a double-edged sword, right? Like you can get kind of too focused on a mindset, but at the same time, there's this idea that, in terms of innovation in vascular surgery, you have a lot of different routes to explore how you can treat vascular disease differently, and you do that at a younger age in the ON5 pathway. And there's huge potential to tailor your training to your specific interests, again, because when you're in your ON5 residency program, you're going to be a vascular surgeon, but hey, maybe you're interested in different clinical areas. So we have one resident now who is interested in learning more about advanced endovascular techniques that they do in Europe, and she's trying to set up some rotations to go out there during her research time. So there's really a lot of time and effort that goes into tailoring things towards your specific interests. So the cons, and I'm reading this book, which is very apt for thinking about life this way, but a lot of our focus, and maybe this is just Western, maybe it's just in the US, but the idea is you should, if you want to be really good at something, you should focus on it and specialize as early as possible. But there's a lot of research that actually talks about the advantages of having range and being broadly exposed to things, both because it allows you to identify what your the matches between your abilities, your interests, and the opportunities that exist in life, but also because it allows you to think differently about things. So like I said, if you're focused on the same thing all the time, you might get pigeonholed into how you might approach a clinical problem. But if you did general surgery training and you're like, hey, there's this instrument we used to use for a different type of case, I think it would be really applicable in this problem that we're having now. Like for me, who didn't do that much time in general surgery, those insights are less likely to occur. So in general, the cons of the ON5 pathway is that medical school may not just give you enough time to try out different specialties. So you think you fall in love with vascular, and then you start a residency and you're like, actually, maybe you're the opposite of Dr. O'Banion and you actually want to do plastics, but you didn't have enough exposure and time to figure those things out. As I've mentioned, focusing too early can be detrimental to your career development, may pigeonhole you a little bit. And so those are things to consider. And so as you tailor your career, you might want to figure out ways to do different things, be exposed to different people. Unlike me, I've been at Stanford for 20 years. And the other thing is this is another double-edged sword. So you do your 5 years of surgical training and then you're out. Well, if you went to a place that so all vascular programs should have a minimum number of certain amount of cases to be a legitimate certified program by the ACGME. But at the same time, a lot of us who practice know that some places do some things more than they do others. And so if the 5 years is all you've got, then you might not feel as comfortable doing certain types of procedures because you just didn't see them as much in residency. And so that might affect where you choose to practice and what you choose to do in your clinical practice. And so that's just another thing to consider. And that's very different than general surgery, where you're going to do 5 years or at least 3 years, and then you go and choose something else for fellowship, where it's more like a finishing school, and you can hone in on the things that you really want to improve your skills at. So that is all I had to say about the pros and cons in my pathway to the ON5 program. And last minute I threw in my kids because Dr. O'Banion had cute kids, and this is truly what it's all about. Like, you know, I have a lot of fun at work. I love what I do, but at the end of the day, these kiddos are the reason for being excited, being a good mom, and liking my job, so that when I go home, I can have fun with them. Thank you.
Well, Elsie, that was a great talk. Excellent. Excellent exposure about where you went in Milan. I love that story. So we had a good question in the chat from Eric Smith at UCSF about, for those who do the 5+2 pathway, what are the benefits of being board certified in general surgery? Is it useful for applying for jobs, etc.? I'm going to put that, since Niten's first on my screen right now, I'm going to ask him, and then anybody else wants to comment on that.
You're on mute, Niten.
You're muted.
Yeah, that was my answer. Now, I don't think it matters as much as it used to. You know, I think in many places, years ago, you used to be considered a vascular/general surgeon. And now, once you do your vascular fellowship, it's rare, you know, unless you're practicing in, you know, a fairly small area or some area in a multi-specialty group where you're expected to do general surgery. So I don't think that it makes as big of a deal as it used to. But, you know, I'm not sure if anybody else has a different opinion on it, but I think, you know, when I finished, it was still something that you were still board certified general surgery with the subspecialty kind of a vascular surgery. Now, vascular surgery, I hate using the term subspecialty because it's its own specialty. We're vascular surgeons. I do vascular surgery every day. I don't do general surgery. And, you know, I think that was a training paradigm that I went through. That was the only one that I had at the time to go through. So I'm not sure how valuable it is in this day and age. And I'm not sure if anybody else on the call has a different opinion on it.
I would wonder that, you know, in rural areas where there may only be one vascular surgeon and it may not be as busy of a vascular practice, maybe that's a situation where, you know, being general surgery board certified may be helpful. Anybody else have comments on that?
Greg, I was just going to kind of echo that. I mean, I 100% agree with Niten. Like, you know, I was all proud that I had my double board certified, but do I use general surgery in my everyday practice? Absolutely not. And if I, you know, do an aortoduodenal fistula, am I going to call the general surgeons to repair the bowel? 100%, because that's what I'd want for my family member, because I don't do general surgery anymore. That being said, you know, if you know the type of practice and where you're going to end up practicing, if you are in a rural place, there still is a pretty high demand for that multi-specialty group where you might be a vascular surgeon, but you do a lot of access and some endo stuff, but you also take general surgery call. And so, you know, I think if you know kind of what you're going to go practice in, that board certification may come in handy, albeit that's probably a rare entity. But, you know, everyone knows kind of in general maybe where you want to end up practicing. And if you're from a very rural town, you want to go back there, it could be something that could be useful for you.
Yeah, just bear in mind that it used to be that having general surgery boards was a precursor to vascular surgery certification. That's no longer present. The vascular certificate is a primary certificate. You can complete general surgery in 5, 6, 7 years. You don't have to get board certified. You can just go right on to get board certified in vascular surgery. And the same on the 0-5 pathway. Obviously, that would be the main thing. But American Board of Surgery has moved it to where it's a primary certificate and there's no need for general surgery board certification at all. The comments that were just made are very valid, depending on if you want to take general surgery call or just somehow be involved in it. But I think for most people, that certified in general surgery, a lot of them are letting that certification lapse and just staying primarily certified in vascular surgery.
I'll just add that I think the one caveat I'd give you if you're thinking about joining a multi-specialty group where, you know, it's 5 general surgeon and 1 vascular surgeon. My friends that have been parts of those groups say that they take general surgery call, but generally when there's a vascular issue, they get called for it. And so just be cautious in the practice you want to pursue as you move forward, because those things can happen.
We got a guest speaker here, Dr. Ziegler, who said if you're going to be involved in a trauma-heavy practice, general surgery training may be useful. Yeah, you could go the Dr. Magee route and get general surgery, trauma surgery, and vascular trained. I don't think there's anything wrong with being trained, having more training. I think that can always be useful depending on what kind of practice you're in.
While we're waiting for a question, Elsie, you're the only one who's gone through the so-called 0.5, although yours is like a 0.7. But I think many of us, I didn't have a choice. Vince didn't have a choice. Leigh Ann, I don't know if they 0.5s were around, and Sarah, I think it was just nascent when you were starting. The question I always have to everyone is that if you knew now what you knew then, would you pursue a 0.5 program? Elsie, you're excused from this one because you already did it. But Sarah? You're muted. We'll come back to you, Sarah. All right. I'll go to Leigh Ann.
Oh man. It's a loaded question. Hindsight's 2020. I mean, I had no clue. I think that the medical students have more information available to them now than they did when I was a medical student. Like joining a VSIG and, getting involved early on. I didn't have that exposure. So if I had been forced to make a decision straight out of medical school, I would have gone into something different and not been as happy as I am today. So I can't say that I'd go back and do things differently because I love the path that I took. That being said, I do think it's really valuable, and I think Elsie did a great job of giving an awesome presentation that, really as medical students use the tools and the, things available to you and really explore all of your options of things that you're interested in. Because now you have that. You have, conferences and VSIG meetings and interest groups and things that you can join to kind of get that sense. Because I do think that, there is something to be said for the 0.5 in terms of getting out and starting your life a couple years earlier than we did. And so I think there's values in both pathways, and it's nice that they're still available, depending on what kind of environment you're, starting out in as a med student and what you're exposed to.
Can you guys hear me now?
Yes.
Oh, sorry, I don't know what's going on. I echo what Leigh Ann said. I think for me, I had no vascular exposure at all in medical school. So had I had to decide then, I would certainly not be here today. I love my general surgery training. I think it totally changed where I am. I came in with very little research and no vascular exposure. And where I am now is fairly heavy research. And obviously I'm a vascular surgeon. So I would definitely have taken the same pathway, but that worked for me. And I think that's the beauty of having both options is whatever kind of your pathway is as a medical student, you can still come out of this in terms of whatever field you want.
Do I get to answer, Niten?
Vince, you're next.
I would do the 0.5. If vascular stayed like how it was when I finished, I think general surgery helped because of all the open cases. But then general surgery moved to laparoscopic, vascular moved to endo. And so if I had all that information now and applied, I'd absolutely do the 0.5 and not do general surgery. What am I doing laparoscopic surgery for 5 years to prepare for what? So I guess, from my point of view, that's what I would do exactly right now. I just have to get in because these young kids are smart.
How about you, Greg?
Yeah, Leigh Ann alluded to the fact that I've done a lot of training, and I would agree with what she said, which is that I really value the training I had. I don't think I would necessarily do it differently because that's sort of like she's saying, you're not happy with your life now. I'm actually very happy with it. But knowing what I know now, and if I was going to start now, as Vince said, if you know you want to do vascular, I recommend people do the O5. I think it's very clear that pathway is, superior in the sense that you get immediately into what you want to do for your life. If you don't know for sure, you just know you want to be a surgeon, you're considering multiple different pathways, then that's where I think the 5+2 pathway is better.
Elsie, would you still do it? Same thing?
Yeah, it's funny because the OWN 5, I think it was the third year it was in place when I chose to do it. And it was actually a hard decision because there was the thought that, oh, you're not going to be as good a surgeon because you didn't get all the general surgery training. But at the same time, around the time I was applying, the vascular surgeons here were starting to think of letting their general surgery lapse. And I was like, oh, that's interesting. If they're no longer caring about being board certified in general surgery, then maybe I'll do this OWN 5 thing. The other thing is that I have a hard time doing things that I'm really not excited about. And so when I was applying, they say, oh, it was so early that they said apply for OWN 5 and general surgery. And so I focused on my OWN 5 applications, wrapped that up with a bow. And then I looked at my general surgery application. I started writing the essay and I was like, no one's going to believe I want to be a general surgeon. So I'm just going to go with these 8 and hopefully I get in somewhere. So yeah, that's it, but it was not necessarily things when they start up, right? You're not sure that they're going to be successful. And so back then it was hard to know for sure and be 100% confident that choosing this path was going to work out.
It's all wise words, and I think we all treasure our training. I look back at my training and I loved it. I mean, it's hard being and for the medical students, it's kind of weird. You're probably thinking about residency, being real, just a time suck, and it is. And there's times in residency that you hate the day because it's just so hard. But when you look back on things that were hard, I think you always look back with fond memories because it was hard and you got through it. And I think we all treasure the time we had. But I tend to agree with Vince. I think I would do a 0.5 now because I know that I want to do vascular surgery. If I know now that I wanted to do it, I think I would pursue that pathway. There is a question from the chat. It says, do you feel that integrated vascular applicants are viewed holistically, or is there still more of a traditional focus on step 1? And is that changing as we move to pass-fail applicants?
I can answer some of that. I think we're all at programs that have an OWN 5 component as well as a fellowship. But in terms of the last few batches, the step 1 has been a good marker. I think it has been de-emphasized in more recent years and more recent cycles. In terms of holistically, you can match well in integrated vascular if you've got other things that are really amazing too. If you're really into research and you show great productivity, or you're really into teaching and you've demonstrated a track record for it, a bad step 1 score won't pull you out of the game. So I think there is some holistic evaluation, although we have looked at step 1 scores just as okay, this person seems like someone who challenges themselves.
I think you're right, Elsie, that at UW, we do the same thing. And Sarah's one of our assistant program directors, and we have everyone review all the applicants. One thing about the integrated pathways, there's usually about 150 applicants to go through, not a few thousand. And so there's not stringent cutoffs that you have to have. And I think you can look at things that are important. There's a lot of changes that are happening. This was a big discussion, and Vince was there at the APDBS where they're talking about not having a step 1. And what's going to happen now? Is it all going to be on step 2? Who knows what's going to happen with that? But I think a lot of emphasis will rely on the letters of recommendation that you get, the rotations you do, the interest that you show in vascular surgery. So I do think that there is probably a bit more holistic kind of review of an integrated pathway because you're not reviewing 800 or 900. It's usually about 150. But there are some metrics that I think you have to be able to do. You have to be able to pass your boards to be a vascular surgeon. So no matter what, those things will come into play. And it's not that we all want people to succeed, but you still have to be able to to take the tests and pass them. I'm not sure if anybody else has any other comments on that.
I think we have like 5 minutes left, and we have a really cool question that I think would be awesome for everybody to kind of weigh in on and end with, which is, what are the coolest things that you see happening in the next 5 to 10 years in vascular surgery, and what advances, techniques, devices, etc., are you most excited about? Sarah, you want to start?
Sure. I mentioned that much of my practice is complex aortic, and I think for me, that is the game changer. Right now, we can only take care of patients with thoracoabdominal aneurysms on label, so to say, at a couple of sites around the country because the devices are not widely available. And what does that mean? It means most patients with large aneurysms, they're elderly and they're not otherwise healthy. And so if it weren't for these devices, they would not have an option for repair. And so I think the fact that, in the next decade, these devices will be more widely available is super exciting because it allows us to treat so many more patients moving forward. So I think that I think is what's really exciting, at least to me. That's also my area of interest, but I think it's super exciting.
I'm going to go against the grain and say I'm like so excited about the technology that's coming up, and and I think it's going to be in the next 5 to 10 years about how we get blood flow to a foot with no pathway to the foot. And so, you have these patients who are end-stage diabetics on dialysis who have the no option foot, and there's so much exciting stuff in the forefront with deep venous arterialization and below the knee technology in terms of drug-eluting stents and shockwave and serenator, and there's just all this stuff being developed to help these end-stage patients to attempt limb salvage. And so I think there's going to be, it's all very novel right now, but I think there's going to be a lot in the forefront because there's a ton of really, really smart people that are dedicated to working on this. So I think for me, that's most exciting.
Elsie?
Sorry, I need to mute. I will say that I think what's going to be exciting is the endo in the non-X-ray suite, or minimum X-ray suite. Like I had the chance to tour the Philips facility in Amsterdam, and they're one of a few companies that are working on like fiber optic light so that you can guide wires and devices without stepping on the X-ray pedal for long periods of time. So just from like a environmental safety, longevity in a vascular career, patient safety standpoint, I think that'll be really cool.
Vince or Greg?
Yeah, I think, Elsie's point I agree with entirely. Basically the ability to do procedures endovascular without significant radiation. And I think probably in the near future, robots are going to come back. The ability to basically guide catheters, wires, sheaths while sitting at your desk.
And for me, I think that we've been great as a society and as a specialty identifying areas that we can improve our care. And the term disparities has come up in a lot of our papers. I think there's a lot of very interested and motivated people to eliminate these in any areas in vascular surgery and in surgery in general. So I think over the next 5 years, that's going to probably take place.
Yeah, I don't know if there's anything cooler after all the stuff you guys said. So I think that was fantastic. Well, listen, our hour is winding up. We got about a minute left. I just want to remind folks that we have a DI webinar Thursday at 5 p.m. And that's being led by Dr. Chavez and Dr. Rowe. Also, I want to remind the attendees to apply for the VSIG scholarship to the Western Vascular. It's in Victoria, Canada. So the one thing about Western, you saw some of those pictures that Leigh Ann had and Sarah had. They're pretty cool places. That's a great thing about living on the West Coast, is that the Western Vascular is always at a pretty cool place. So I would highly recommend that you apply for that. And the meeting will be in September. And I think everyone is looking forward to it. And please go to the website and apply. If there's anything else, I think we're about done, guys. We're at 6 o'clock. I'd like to thank all the panelists. That was a great session. And, and once again, if there's any other questions, please feel free to reach out to us. We can, we're all available to talk about the specialty. You can hear how much everyone loves what they do. And we would all be happy to talk to you more about the specialty. But thank you guys very much for attending. And I'd like to thank all of our panelists for participating, and look forward to seeing you guys soon.